get started. All right, so task one is presenting the case. The case summary is a 54-year-old man presents with a 3-week history of progressive dizziness, mild diffusion and headaches, and tendinitis in the right ear. He describes the dizziness sensation of the veneering to one side affecting his balance and ability to walk or cycle. His headache lacks visual aura, which differentiates its history from migraines treated with the Simpertanian. Physical examination reveals diminished of the right ear hearing. A Weber test lateralization is also done on the left. Neurologic findings include unsteady gait, absent caloric response in the right ear. Evaluation confirms moderate hearing loss in the right ear with severe tendinitis. There is also an MRI with contrast revealing 2-centimeter mass at the interval auditory meatus, consistent with an acoustic neuroma. Including the patient demographics is also crucial because in a medical case, they provide context for risk factors such as disease prevalence and potential differential diagnoses. For instance, acoustic neuromas are most commonly diagnosed in middle-aged adults, aligning with the patient's age. Additionally, gender differences can influence a symptom and presentation or disease patterns, while race may also relate to genetic pre-diagnosis, health discrepancies, helping healthcare professionals make informed diagnosis and treatment decisions. Task 2, analyzing medical terms. Highlighted medical terms from the case include migraines, tendinitis, acoustic neuroma, metastatic gadolinium, audiologic, and caloric stimuli. Tendinitis is going to be the condition referring to the perception of the ringing or noise in the ears without an external source being within the ears. Labyrinthitis is going to be inflammation describing the inner ear labyrinth, often leading to vertigo, dizziness, or imbalance difficulties. Lastly, acoustic neuroma is going to be the benign of the vestibular nerve responsible for hearing imbalance, commonly located at the internal auditory meatus. These terms highlight the complexity and precision of the medical terminology in diagnosing and understanding all conditions. Task 3, define a common medical abbreviations. Highlighted in their abbreviations, I did put BP, S1, and S2, MRI, and BP. Standards for blood pressure, which measures the force exerted by the vessels on the walls, typically reported in millimeters. An MRI, or magnetic resonance imaging, is a non-invasive imaging technique using magnetic fields and radio waves on it to create detailed organ and tissue images. In this case, it is identified a 2 centimeters mass at the internal auditory meatus with the gadolinium contrast. S1 and S2 are the first and second heart sounds representing closure of the heart valves, and then are essential in evaluating the cardiovascular function. These abbreviations showcase the concise yet detailed communication necessary in the medical practice. Task 4, offer differential diagnoses. The most likely diagnosis is going to be acoustic neuroma on the right side with a tumor of the Schwann cells. This diagnosis is supported by the patient's progressive tendinitis, moderate hearing loss confirmed, the evaluation, and the MRI with the gadolinium contrast revealed a 2 centimeter mass at the internal auditory meatus, fluctuating in hearing loss, and the findings are inconsistent with the imaging and the clinical presentation listed. Task 5, significance of the medical terminology. The significance of the medical terminology in the healthcare is a solid understanding that is essential, that serves a foundation for effective communication above all the professionals listed and to ensure ethical, precise, and standardized patient care. Medical terminology also upholds standards in the patient care. For example, by healthcare professionals using BP, they may confuse it for bipolar disorder or blood pressure. It could clinically alter clinical decisions. Furthermore, the use of standardized medical language demonstrates the professionalism and dignity of confidentiality and documentation. Healthcare providers and the sensitives are conveyed respectfully and confidentially, aligning with ethical and legal standards. Lastly, medical terminology contributes to the integrity of the healthcare practice by fostering shared understanding amongst team members across disciplines, ensuring that all providers are aligned with their goals and methods. This standardization is critical for the collaboration in providing patients with their highest quality of care. And then I do have my sites listed through the National Institute, American Medical Association, and the World Health Organization through Garmo and the 2018 case studies, as well as a 2020 medical terminology systems approach. Thank you for your time, and I hope you have a great week. And showcased here, I have my slides that I went through. Go ahead and do a skim through those, and I'll provide the link as well in the description. Here I have task 1. Task 2. Analyzing medical terms. Here I have task 3, defining common medical abbreviations so that we can showcase concise, detailed communication that is necessary in medical practice. Task 4, offering differential diagnoses. For example, acoustic neuroma on the right side, as I described prior in the video. Task 5, the significance of medical terminology, while we provide collaboration in providing patients with the highest quality of care. And then there I have my citation.